Electronic health records have providers staring at screens more than ever before. The result? Longer hours, fewer patients in a day, lower revenue, and frankly, less eye contact. But what if there were a way to improve clinic efficiency, empower providers to focus on patients instead of the screens, and increase revenue? Well, there is. DocResponse allows providers to reclaim that productivity, increase their revenue, and raise quality of care. How does it work? DocResponse removes the burden of data entry by having patients enter information themselves. It starts with patients scheduling an appointment themselves through DocResponse. They check in, either in the waiting area or remotely through a practice website link, sign all required consent forms, and enter medical, surgical, family, and social histories, along with review of systems. Patients will then enter the assessment tool to answer questions developed by board-certified specialist physicians. Results of the entire assessment can be pushed directly into the patient EHR note. History of present illness will have a fully completed note, which can be confirmed and edited after the patient interview. A differential diagnosis and treatment recommendations to consider are ready for the provider to evaluate prior to the patient visit. DocResponse reduces the provider and staff data entry significantly. In-clinic results show a reduction in staff and provider documentation time by over 40%. DocResponse also provides greater knowledge about the patient's ailment prior to the patient visit. Last, content about each diagnosis can be provided to the patient as a printout at discharge or by email to assist in patient education. DocResponse, the first step in automating the entire clinic experience. See more patients, increase revenue, reduce overhead,